Welcome everyone. It gives me great pleasure and utmost pride to welcome Dr. Athul Govind, the numero, of this NEET SS Pediatrics group exam. The results just came out a couple of days back or so, and I can only, want to hear it from you, Athul, how you're feeling with this. It's like the pinnacle. So how are you feeling right now?
Thank you so much, sir, for inviting me. I'm so happy. I'm very happy now and so relieved now.
Great.
I
So
actually,
yeah,
I didn't expect that this much rank. I was really shocked for that when rank came.
yeah, like I agree. Like when you see one no, you just have to check multiple times because
Yeah,
it's really a feeling that is
yeah.
undescribable.
I forwarded that to my many of my friends, and I asked check it again and again.
Maybe there's some glitch in your laptop. You might have thought, yeah. So great result, and like for our viewers, obviously they would want to know where you're from, what has your academic journey been, how you have dealt with through your residency and your preparation.
Okay, I'm from Calicut, Kerala, and I did my UG from Government Medical College, Calicut, and MD Pediatrics from Government Medical College, Trivandrum. And I completed my SRship in 2023, and then I had started working for past 2 years.
Great, Dr. Atul. And like obviously through your as you took a break, there was a gap between the MD part and your SS preparation. How was your MD days? Like were you into your clinics, into the ward works, or were you always having an eye on the SS things?
No, sir. During my MD period, my main focus is only on the patient cases and all things. And there's any SS was not at all a plan for me. But complete for after completion my SRship, I had some an idea. I had to do something else. Yeah, but due to some financial and responsibility and also family commitments, I was not able to do that at that time. So I take a break and started working for this last 2 years. And I actually seriously preparing for this NEET test for past 6 months, around July 2025, sir.
Great, Atul. It was. I mean, obviously, in this part of the age, it's always a challenge to balance both worlds. Either before DM, through DM, or after DM, you have to give time for family and everything. So it's good that you have said got that set, and now you are completely into the best part of DM. So also like in pediatrics, most of our students have this confusion. Everybody has this confusion. Firstly, whether we need to do SS or not. So, in your case, how you took that decision and what is your perspective on this?
Yeah, same, sir. I got that's that much feeling that feeling also same feeling or whether to do it or not. Then during that residency, there was academic my college academics was really good, and there was so much exposure to the cases. But in during that working period for last 2 years, I saw only some cases. There were many respiratory cases, etc. So I was started. I was to do something else, and many and I like that subject was pediatric neuro, and so I thought for managing that other cases can be easily managed by a pediatrician. Also, some super specialization is required for that management of cases and all. So I started to think about my super specialization.
Great, Atul. And I think PEDS Neuro is actually one branch where even all the pediatricians, the general pediatricians, they will definitely refer and they require the super specialist, care. And also, it is also very competitive. Like if you look at the most of the, if you leave neonate and critical care, the most subject in which most students are interested in terms of organ system pediatrics is neurology, and it shows in the competition also. Now obviously you have all the choices on your plate, but it was a very brave choice and to decide on that. Once you took that decision, obviously then you had to plan how to prepare. So how, please explain to your juniors who would be listening very carefully, for their guidance on how you made your basic preparation material and how you added on things and how you practice things.
Okay, sir. The major fundamental thing was, the core thing was the Nelson only, and the Nelson textbook, and then the test series, and so because the Nelson is the key, and I had an advantage that I had already handwritten notes from the Nelson, around 70 percentage. I had it. I had prepared in my during residency days, but I did not revise that during this 2 years. So the major thing was, uh, I was started to study that NEET SS notes again, and then the without MCQ practice, it was not complete. So I had uh, subscribed this doc tutorial QBank and Elite test series. So I started almost on 6 months back. So my preparation strategy was that only revolved around that Elite test series. So I started according to that timetable only. So I allotted around 5 to 7 days for my subjects, and then previous mini test, and also the previous LI test, and then also I could find the most important topics from the last 3 years any tests. I written that topics, the major topics from the previously asked questions. Each subject I had the most important topics. Then those topics only I read line by line from the Nelson, then added to my notes. Then again from the QBank, I did my QBank mini test, and then finally I attempted the live LI test. And after that, the discussion videos was so helpful, and it helped me to find out where is a place I am lacking, new concepts, etc. That was also added to my notes. Then the same sequence was followed for every subjects, that the note reading, then QBank, then mini test, and then final LI test. So I completed around the complete subjects within three months, around mid September. Then I had two to three revisions in the month of October. I had one revision, and second revision in the November. Then last revision in the December. Then last 10 days I revised my notes. Then during the revision time, I had prioritized my weak areas. I had given more time for that weak areas. My mainly the general pediatrics was genetics was my area. The cardiology was weak areas. So that helped me a lot to solve this time. There were more questions from the general pediatrics, IEM, genetics, and also scenario based questions, etc.
Great, Atul. And I think like there's no doubt that Nelson is forming the core for your preparation, and you made your own notes from Nelson, which is like a brilliant thing. But also I'm so happy that you utilized the our PYQ section, because our PYQ section, I feel a lot of students are looking at now, and they are adding on important topics from there, and also the elites, which obviously help you structure your preparation system wise.
And
And
once more, the
when it
grant test. So, sir, the grantors was so much helpful, because initially I was not at that having that confidence to do that initial Excel, but after a 3 to 4 LI tests, I was started to do that grant test every once in 2 weeks, etc. So it was very really helpful for time management, accuracy, etc.
Yeah, and I think this now it is even more important because there is a little bit more change in the pattern with respect to these
Yes,
blocks. So that 50 block kind of a preparation is necessary. And I think another important addition in our program is the mini tests that also help you in structuring your preparation daily. Just 20 questions, that is also
yes, sir.
uh,
During my in between my OPD also, I have to do that 10-20 questions mini test. So this was very helpful.
And Atul, I think like we were just for the viewers, we were just talking to before the interview got live, and I loved one the clarity that Dr. Atul has with respect to the question that I had, that students get confused with respect to NEET SS and INISS, and this time it was a lot more because initially NEET SS were before INISS, then it became after INISS. Obviously, with NB, you can never predict what date is going to come, but Dr. Atul, can you just explain how you had this clarity about this confusion?
Yeah, my focus only on this NEET SS only. I didn't attempt any INI SS because there was many few seats and all, and I had clarity that I will aim for only NEET SS.
Great, Atul, and I think like you have looked at the how Arjuna looks at the bird's eye and hits a bird's eye right in the center, right? So great. Then coming to how doctor tutorials helped you with respect to Q Bank. Like what else? Like were you there in the WhatsApp group? Anything specific that you would tell the junior that they can utilize our platform very well?
Yeah, yeah, true. That the Q bank is the most important because I utilize that around 95 percentage. Except from that statistics part, I done almost twice the Q bank, and mainly the LI test is much more important, I think, because all the questions, all the important questions are there in the LI test, so it will be very helpful. Then I last two revisions I bookmarked that questions from the Q bank, and I did again that twice or thrice.
Nice, nice. And
Then the WhatsApp group also, that was really helpful for me for clearing doubts, discussions, etc. Was so helpful.
and anything else for your juniors, especially because they are the ones who would be listening to the interview through their residency, at the end of residency, with respect to the many confusions that students have afterwards through the preparation, how they are, any guidance you want to give them?
Yeah, I think it mainly the Nelson is the key, but the by during residency we should focus on the patients, cases, etc. So whenever you will get time during in the first year there may be hectic, but in during the last second or third year, if we found the cases in OPD, just refer to that from the Nelson itself. Then try to find some notes, etc. From that also, it will be so helpful. And then also the clinically oriented, the NICU, PICU postings, and then that helped me a lot because there in this time there are many conceptual questions, NICU, that there will be scenario based questions, ventilation, etc. That will be very helpful from that residency period and exposure.
Great. And I usually don't ask this question to everybody because they want to keep their, like their preferences to themselves, because anything can happen in counseling. But I can ask this to you, obviously, that because you're rank one, you can take anything. Like, what are your interests going ahead, like with respect to your branch and as well as your, a location? So, what are you thinking about? Obviously, you might be still
Yeah.
thinking a little bit. But what is your
Yes, I'm
thought
in a
process?
confused state now, actually. But actually, I like the during my residency, I had exposure for different cases, and I like the subjects of pediatric neuro, and so I'm planning to take most probably.
Great, great, Atul. And I think in Kerala you have some excellent institutes for pediatric neurology. So you will do great, staying nearby your home in God's own
Yes,
country. Yeah.
yes, sir. Yes,
So
sir.
yeah. So and like obviously the rank stands on your efforts, on the shoulders of your efforts, but you will have a support system, including everybody who helps you get the rank. So whom would you like to thank with respect to that?
Yes, yes, sir. I'm first of all my family and my wife, because last 1 month I had to took leave from that my work, and also so all this family responsibilities, everything was accidentally managed by her, and so I thank my wife and my parents and my best friend, and also my mentors and teachers from the Government Medical College Trivandrum during my PG days, which helped me a lot to make my fundamentals everything right, and the base from there only.
Great, Dr. Atul. I think it was great talking to you. I think the best thing that I loved about what you told is the clarity. And I think this sometimes it is natural to feel confused, but that thing managed very well. And I loved that mindset. Thank you so much
Thank you,
for
sir.
talking with us. You will do great.
Thank you,
All the
sir.
best for the future.
Thank you so much, sir. Thank you.